Good morning, everyone, and welcome. Thank you so much for attending this absolutely wonderful educational event. I'd like to thank all of you who attended here personally, and I'd like to thank all of you who are online right now. We have people who have dialed in from all over the world who are on webcasts, so we're going to be taking questions from them as well. First, I want to take care of a few little housekeeping. Next slide. Let me see, I think I could do that myself here. Just a couple of things. Questions, please raise your hands. We will have microphones that will meet you. We have people in the back of the room with microphones where we have question and answer cards that will be available to you as well. If you don't want to raise your hand and speak into the microphone, we have cards as well where you can write your questions, and I'll be happy to take them and ask the question for you. And in the webcast, please feel free to type your questions right there as well. Handouts, you all see a blue packet, and within that blue packet you will have quite a few handouts. You'll see the agenda for today, the faculty and their affiliations. You will see many articles of interest for you, and just for everybody always ask this question, the slides will be provided to you on the website after this, this educational event. So also, there's many of you who would like to have CME or CE credit for this educational event. So you will see that we have handouts, and please fill those out as well. Everyone, we just want you to know that we have a fantastic gala tonight. If you are not coming or didn't know about it, we still have tickets available, so please join us tonight. This is our yearly fundraiser. It's going to be a fantastic event. We have many, many people coming, and we raise money here to, for research and for education, so please join us. If you're interested, please see the young ladies at the front desk. So thank you. And photos, if we have any people who are afflicted with stomach cancer here, we had during lunchtime, we have like a group picture. So during lunchtime, please join us here in the front and we'll take some pictures. So thank you. Next slide. One of the things I want to thank, we've been very, very fortunate to have some sponsors help us. This educational event was co-sponsored by the Debbie's Dream Foundation, Curing Stomach Cancer, and Prime Oncology, so thank you very much for that. In addition, we've had some wonderful supporters, and we could not do this without our sponsors and supporters. Our lead supporter here today is Lilly Oncology. We have Memorial Hospital West medical staff, the Memorial Cancer Institute, Broward Health, Health Plans, Pat and Maureen Campola, Debbie Zelman and Andrew Gutman, and Madeline and Danny Zelman. So thank you so much. We could not have done this without them. So let's give a round of applause. Thank you very much. The other thing is, you know, behind the scenes, putting together an educational event like this is very tedious and takes a lot of time. And this could not have been done without an incredible, incredible committee that put all of this together for you today. The co-chairs are Peter Sprague. Peter Sprague's in the back. Thank you very much. Peter Sprague and myself are the co-chairs. We have Debbie Zelman, Donald Zelman, Rob Schaffel, Stacy Roberts, Dylan Larson, Randy Hillard, Allison Gordon, Pat Campola, and Bob Benson. Thank you very much. Great committee. One of the things I'd like to do is, just by raise of a hand, I'd like to know who's in the room. So I'm going to ask these questions and put yourself in a category. So if you are a physician, please raise your hand. And somebody in the back of the room, please, if you can capture the numbers in the back of the room, somebody. Okay, if you're a physician, okay, welcome. How about a nurse? Quite a few nurses, welcome. Other healthcare professionals? Great. Patient? Welcome, all of you. Patient family member? Wow, great support for the family. A patient friend? Yay. A caregiver? Great. And how about just want the education? Oh, we got a few there, welcome. And other category? Okay, welcome, welcome. So again, we're all here to receive something from the day. And one of the things that we are so pleased to bring to you is an esteemed panel of speakers. Many of you may not know, but we have speakers here who are very large thought leaders in their field, and we're so pleased that they're here. Just want to go over the agenda for today. Today, as you know, my name is Libia Scheller, and I'll be the moderator for today. And we have Debbie Zelman, who is the president and founder, who will be the next speaker. We'll talk a little bit about the background and the history. Then we'll follow with our first speaker. There's a lot going in the field of genomics, and we have Dr. Adam Bass, who will be speaking about genomics. We have William Blackstock, who's here at the end of the table here, who will be speaking on radiation oncology. We have Jeffrey Norton, who will talk on novel surgical options. We have Jaffer Ajani, who will talk about non-surgical treatment options, and then we're going to break for lunch. During lunch, just remember, we're going to take a couple of pictures in the front, so that would be wonderful. In the afternoon, we'll be covering a great topic called Demystifying Clinical Trials by Jordan Berlin. We will have David Ilson talk about advancements as a result of clinical trials. We have Edith Mitchell, who will talk about side effect management. And we have Kathleen Mary Wesa, who's here on the panel, who will be talking about integrative medicine and nutrition considerations. One of the other things that's wonderful, we will have a patient panel this afternoon where you can ask a lot of questions to our patient panel as well. So thank you very much. Well, that's the afternoon. Okay, the other thing I'm so pleased to present to you a very incredible human being who, without any of this, this would not have been possible. I'd like to introduce Debbie Zelman, who's an incredible person who's put all this together, who's led all of us into the march of advocacy for patients. She's done an incredible job at the NCI, and within trying to get awareness for clinical trials and support for patients. So I'd like to introduce my friend, and I have to tell her she's one of my heroes. So thank you, and I'd like to give a round of applause to Debbie Zelman.
Good morning, everyone. Welcome. So as many of you know, I was diagnosed with stage 4 stomach cancer in April of 2008. My twins were 10, my little one was 3. And I was told that my chances of being alive in 5 years was 4%. It's now 6 years. At the time, I had no risk factors for stomach cancer. I was a mother of 3 and a practicing attorney. I received chemotherapy for the last 6 years, every 3 weeks. Right now, I have a recurrence, and I am being treated with a different chemotherapy and with radiation, and I'll be getting that for 5 weeks. So, you can do this. We can all do this together. So in a year after I was diagnosed, I founded Debbie's Dream Foundation, and the mission is to raise awareness, to advance funding for research, both directly and indirectly, and to provide education and support for patients, families, and caregivers. And our ultimate goal is to make the cure for stomach cancer a reality. So along with that education and support of the patients, we started the Patient Resource Education Program that we abbreviate PREP. Sort of a little feedback. We help hundreds of patients, families, and caregivers from around the world. We've helped patients in 26 states and 9 countries. We have patient resource education mentors who are assigned to the inquirers based upon stage and biomarkers, also based upon, if we can, age, gender, and region. It's a really vital program that we offer. If you're not already enrolled in our PrEP program, I encourage you to do so. It's very easy. On the homepage of our website, you click on you click on Resource Inquiry Form. You complete a 5-minute form, and you get assigned a mentor, an invaluable resource, and it's free. So along with those resources, we have just a very rich website full of resources for stomach cancer patients, families, and caregivers. And included in those resources is a website with all that information that is translatable into 60 different languages. We have a lecture library from all of the symposia that we do. You can go back and look at those lectures from each year. We have educational symposia and webinars throughout the year. We have a clinical trial matching service, survivor stories, a blog, a brand new stomach cancer stomach cancer support community. So that I really encourage you all to join. That's an incredible resource. We now have 20 chapters in the US and Canada, with a brand new one starting in San Francisco. And what we hope to be our 21st chapter is one starting in Germany. We have hundreds of volunteers throughout the country, and including, which I love this photo, the young children who are involved in the school clubs and youth leadership councils. We have many events upcoming. Please check out the website for a listing of those events. It may be in your area. In addition, in November and some other times during the year, we have events that are worldwide. November is Curing Stomach Cancer Month, so we encourage you all to get involved in those events. We're very excited to announce that we just awarded our first research grant to Dr. David Allison. He is from the University of North Carolina at Chapel Hill. He received the Young Fellowship Award from us, and Dr. Allison is actually here in the room with us. We're very excited to have him with us. Dr. Allison. Thank you so much. In addition, we believe that indirectly influencing the funding of research can be incredibly impactful. So we have brought the message to Capitol Hill to tell them that per cancer death, stomach cancer receives the least amount of federal funding of any cancer, the least. So we had our first advocacy day on Capitol Hill in Washington, D.C. last year, and we have been moving mountains with that, including getting the reaction from the Hill staffers of, we never knew stomach cancer was our problem. And I said to them, that's why we're here. So this year, we went from 30 last year advocates to 57 this year. We had over 70 meetings on the Hill. That's a picture of all of us on the steps of Capitol Hill. And this was also groundbreaking, the first ever Capitol Hill briefing, where we briefed the staff of Congress on the state of stomach cancer. It was an incredible day, and really educated them, because those staffers in the room are pretty young. Stomach cancer is actually on the rise in young people ages 25 to 39, and they don't know why. Scary, right? So we educated them and brought the message to them. And of course, the message is join us, help us make a difference. Your voice added to ours makes it louder. The message has to be louder. So we are not just me, as you can tell. We are many of us. We have 13 incredible board members, 3 corporate advisory board members, and 6 honorary board members. So, of course, it's an incredible message that we send. And this is our extensive and amazing medical advisory board. We have 25 members, including a new one in Spain and a new one in Germany. A few pictures of our board members at various meetings throughout the country. Some of those people you will hear speak today. So thank you so much for your attention, and I turn the microphone back over to your incredibly talented Libia Scheller, and thank her and her co-chair Peter Sprague and their amazing committee who made today happen. Thank you.